Did you know that a staggering 60 million Americans experience acid reflux at least once a month? That's right, folks. This isn't just a handful of people suffering after a heavy meal. This is a major chunk of our population dealing with discomfort and pain more often than we might think. This prevalence underlines how essential it is to understand this condition. Acid reflux is not just a minor nuisance, it's a significant health concern for many. It's clear that acid reflux is a common issue, but what exactly is it? To better understand this, we've spoken to a few medical professionals. Acid reflux, or gastroesophageal reflux disease, is a common condition that affects many people worldwide. As explained by Dr. Smith, a renowned gastroenterologist, acid reflux occurs when the lower esophageal sphincter, a ring of muscle that acts as a gate between the esophagus and the stomach, doesn't close properly. This allows stomach acid to flow back or reflux into the esophagus, causing discomfort. But what causes this malfunction in the first place? According to Nurse Johnson, a specialist in digestive health, several factors can contribute to acid reflux. These include obesity, smoking, certain medications, and even certain foods and drinks, such as spicy foods, alcohol, and coffee. The symptoms of acid reflux can vary, but the most common ones are heartburn, a burning sensation in the chest, and regurgitation, a sensation of acid backing up into your throat or mouth. Other symptoms may include bloating, burping, nausea, and a sore throat. Dr. Patel, another expert in the field, adds, persistent acid reflux can lead to more serious conditions like esophagitis, an inflammation of the esophagus, and even esophageal cancer. That's why it's important to seek medical attention if you're experiencing symptoms. Now that we've got a grip on what acid reflux is, it's time to delve into how it's diagnosed. Let's take a moment to visualize what happens during an episode of acid reflux. As we delve into this, an animated representation of the human digestive system appears on screen. Here we see the stomach, which is responsible for breaking down food using stomach acid. The animation shifts, highlighting the stomach and its churning acid. Above the stomach, we have the esophagus, a tube that carries food from our mouth to our stomach. The esophagus is now highlighted. At the junction of these two is the lower esophageal sphincter, our body's natural barrier against acid reflux. The sphincter is then highlighted, a small ring of muscle. In a healthy digestive system, this sphincter closes tightly after food passes into the stomach, preventing the stomach acid from flowing back into the esophagus. The animation shows the sphincter closing post-food passage. However, in individuals suffering from acid reflux, this sphincter doesn't close properly. The animation changes, showing the sphincter partially open and acid seeping back into the esophagus. This backflow or reflux of stomach acid into the esophagus is what causes the discomfort and potential damage associated with acid reflux. The animation concludes with the acid causing visible irritation to the esophagus. Now that we've seen what acid reflux looks like, let's move on to how it's diagnosed. Before we continue, please show us some love by liking us and subscribing to our channel, Vitals Health. You will stay updated on the latest health news and tips, and be the first to know about our new videos. So don't wait, click the subscribe button now, and join the Vitals Health community. How is acid reflux diagnosed? Diagnosing acid reflux isn't always straightforward. Here's what the experts had to say. While we might be tempted to self-diagnose, especially when symptoms appear clear, it's important to remember that acid reflux is a medical condition and should be diagnosed by a healthcare professional. You see, acid reflux or gastroesophageal reflux disease, GERD, is diagnosed based on a patient's symptoms and response to certain treatments. A doctor will typically start by asking about your symptoms, like the frequency and severity of your heartburn, if you have difficulty swallowing, or if you're experiencing any chest pain. The doctor might also perform a physical examination, paying close attention to your throat, chest, and stomach. However, understanding acid reflux isn't just about identifying symptoms, it's about ruling out other potential conditions that might be causing similar discomfort. To confirm a diagnosis, your doctor might suggest a few tests. One common test is an endoscopy, where a thin, flexible tube with a light and camera at its tip is used to look inside your esophagus and stomach. This can help identify any inflammation or damage that might be causing your symptoms. Another test is the 24-hour pH probe study. During this test, a thin tube is placed in your esophagus to identify when and for how long stomach acid regurgitates there. This helps the doctor see if acid reflux is the cause of your symptoms. There's also a test called esophageal manometry. This measures the rhythm of muscle contractions in your esophagus when you swallow, helping to reveal any abnormal functioning that could be causing acid reflux. In some cases, doctors might even recommend a barium swallow radiograph. This involves swallowing a solution that coats the lining of your digestive tract, then taking X-rays to see if there's a narrowing of the esophagus or an abnormal shape, which could be contributing to acid reflux. Each of these tests provides valuable information that can help your doctor determine the best course of treatment for your condition. So, it's essential to see a doctor if you suspect you're dealing with acid reflux. But what can you do to manage it? Managing acid reflux. Acid reflux can be a pain, literally, but there are ways to manage it. Let's hear from the professionals. The key to managing acid reflux lies in three main areas: dietary changes, lifestyle modifications, and medication. Let's delve into each one. Firstly, dietary changes. It's no secret that what we eat can have a significant impact on our health. Certain foods are known to trigger acid reflux, including fatty or fried foods, spicy meals, citrus fruits, and even chocolate. By identifying and avoiding these triggers, you can significantly reduce the frequency of your acid reflux episodes. In addition, eating smaller meals more frequently, rather than 3 large meals a day, can help prevent your stomach from becoming too full and pushing acid into the esophagus. Now let's talk about lifestyle modifications. If you're a smoker, quitting can improve your acid reflux symptoms. Losing weight if you're overweight can also help, as excess weight puts pressure on your stomach, forcing acid up into your esophagus. Even the way you sleep can make a difference. By elevating the head of your bed or using a wedge-shaped pillow, you can help keep stomach acid where it belongs while you sleep. Lastly, medication. Over-the-counter antacids can provide quick relief by neutralizing stomach acid. If your symptoms persist, your doctor might recommend stronger medications, such as proton pump inhibitors or H2 blockers, which reduce the production of stomach acid. It's important to remember that while these medications can help manage your symptoms, they do not cure acid reflux. They should be used in conjunction with dietary changes and lifestyle modifications for the best results. Remember, everyone is different. What works for one person might not work for another. It's about finding a balance that works for you. This might involve a bit of trial and error, but don't get discouraged. It's a journey, and you're not alone. With the right steps, you can effectively manage acid reflux. But what's the experience like for those living with it? Living with acid reflux can be challenging. We've spoken to some individuals who've shared their experiences. Imagine waking up in the middle of the night with a burning sensation in your chest, or having to turn down your favorite spicy food at a party because it might trigger an episode. These are just a few of the many ways acid reflux can impact someone's daily life. Let's hear from some of these brave individuals. First, we have John, a fitness trainer from Austin, Texas. He describes how acid reflux affected his love for food and fitness. He had to modify his diet significantly, cutting out spicy foods and caffeine. He also had to adjust his workout routines to avoid exercises that might trigger his acid reflux. Despite these challenges, John found a silver lining. He says that his new diet and exercise routine has not only managed his acid reflux, but also improved his overall health. Next, we hear from Mary, a mother of 2 from Miami, Florida. Mary had to juggle her acid reflux symptoms with her busy schedule. She found relief in small, frequent meals and avoiding food close to bedtime. She also shares how she had to educate her kids about her condition, turning it into a learning experience for the whole family. Lastly, we have Sam, a college student from San Francisco, California. Acid reflux affected Sam's sleep and study habits. He found that avoiding late-night snacks and elevating his bed's head provided some relief. He also discovered that stress management techniques like yoga and meditation helped him control his symptoms. Living with acid reflux is undoubtedly challenging, but as John, Mary, and Sam have shown us, it's about finding strategies that work for you. Whether it's dietary changes, lifestyle adjustments, or stress management techniques, there's hope for everyone dealing with this condition. As you can see, acid reflux affects everyone differently, but by sharing experiences we can learn from each other. Acid reflux is a common condition, but it doesn't have to control your life. It's a mantra worth repeating and one that we've emphasized throughout this video. Today we've embarked on a journey to understand this widespread condition, its symptoms, diagnosis, management, and the everyday realities of living with it. We've learned that acid reflux is more than just an occasional inconvenience. It's a chronic condition that can affect your everyday life, from the foods you eat to the way you sleep at night. But it's not all doom and gloom. With the right knowledge, you can manage acid reflux and keep it from controlling your life. Remember, understanding is the first step towards managing any health condition. We dove into the causes of acid reflux, shedding light on how our eating habits, lifestyle choices, and even genetics can contribute to this condition. We unraveled the mystery behind acid reflux, making it less intimidating and more manageable. Next, we talked about diagnosing acid reflux. We stressed the importance of medical consultation if you're experiencing persistent heartburn or other symptoms associated with acid reflux. It's essential to remember that self-diagnosis can lead to misdiagnosis. So, seek medical advice, get a proper diagnosis, and start on a treatment plan that's tailored to your needs. Then we delved into managing acid reflux. We outlined various treatment options, from lifestyle changes to medication and even surgery for severe cases. We emphasized that managing acid reflux is a holistic process, involving not just medication but also dietary and lifestyle adjustments. Finally, living with acid reflux doesn't mean living a life of constant discomfort. We shared tips and tricks to make life with acid reflux more bearable, from sleeping positions to food choices. We hope this video has been informative. If you've experienced acid reflux, we encourage you to share your experiences in the comments. Remember, you're not alone in this. Let's continue the conversation, share our experiences, and support each other. Knowledge is power, and together we can take control of acid reflux instead of letting it control us.